Assalamu alaikum. Our lecture today about polyposis. Nasal polyps are chronic disease of upper respiratory tract that form as an end result of severe inflammation of the nose and paranasal sinuses, and are considered to be a subgroup of chronic rhinosinusitis. Morphologically, nasal polyps are edematous grape-like protrusion, most often originating in upper respiratory or in upper part of the nose around the osteomeatal complex on the lateral wall of the nose. The surface epithelium tends to be smooth and consists of pale translucent tissue which distinguishes them from more vascular mucosa of the nasal cavity. Definition: nasal polyp are best thought of as to be defined as a chronic rhinosinusitis with nasal polyps, and European guideline they define these conditions clinically as inflammation of the nose and paranasal sinuses associated with two or more symptoms, one of which should be nasal blockage or nasal obstruction, congestion, or nasal discharge. Facial pain or pressure, reduction or loss of smell, and either endoscopic evidence of polyp and or mucopurulent discharge from the middle meatus or edema mucosal obstruction primarily in the middle meatus, and or changes in the mucosal changes within the osteomeatal complex and or sinuses. Incidence and prevalence. In the normal population, the prevalence is between 1 and 4% in adult and 0.1% in children. Nasal polyps are more common in male, and there is no racial predilection. Clinical presentation depends on the extent of the polyp disease. Small polyps may not produce symptoms and may be defined incidentally during rhinoscopic examination. The cardinal symptoms of chronic rhinosinusitis with polyp are: 1. These are important: nasal obstruction, nasal or post-nasal purulent discharge, facial pain, and pressure, and disturbance of smell, hyposmia or anosmia. Rarely, proptosis, hypertelorism, and diplopia can result from alteration in the craniofacial structure. Pathogenesis, resulting in dysregulated interaction between the sinus epithelium and the lymphoid system. Histologically, they consist of loose connective tissue, inflammatory cells, and fluid, and are usually covered by pseudo-stratified columnar ciliated epithelium. Polyps form when edematous connective tissue stroma ruptures and herniate through basement membrane. Allergic fungal rhinosinusitis, it is type 1 hypersensitivity reaction to fungal antigens, in which patients usually present with unilateral or bilateral nasal polyps. Approximately 80% of patients with fungal sinusitis have nasal polyp. This is also important. This table shows the classification of allergic fungal rhinosinusitis, major symptoms and minor. You can read it. Systemic disorders associated with nasal polyposis, such as, this also important, primary ciliary dyskinesia, cartilaginous syndrome. This is a clinical variant of primary ciliary dyskinesia. This is a clinical variant of primary ciliary dyskinesia and is a triad of chronic sinusitis, bronchitis, and sinus inversus. 27% of patients with cartilaginous syndrome have nasal polyp. Second, cystic fibrosis. 3, Samter triad, which is aspirin sensitivity, nasal polyp, and asthma. Asthma, 7% of patients with asthma have polyp. And the last is Church syndrome, asthma, peripheral eosinophilia, pulmonary infiltrate, and systemic eosinophilic vasculitis, and allergic fungal sinusitis. Diagnosis. Anterior rhinoscopy is the first step to diagnosis, but inadequate alone and cannot exclude polyps. Right lens nasoendoscopy after topical decongestant is needed for diagnosis, as well as identifying discharge, crustation, scarring secondary to previous surgery. Plain sinus radiographs are insensitive and should not be used to diagnose polyps. CT scan with coronal section is an investigation of choice. This is important for assessing the extent of the disease and detailing the anatomy before surgery. Magnetic resonance imaging, MRI, may be helpful to differentiate from tumor and if intracranial extension of the disease is suspected. Management. Treatment aims to eliminate the symptoms and nasal polyp, reestablish nasal breathing and olfaction, prevent recurrence, and improve patient quality of life. These are the aims of our management. The treatment can be divided into medical and surgical. The medical treatment include medical systemic steroid. They have anti-inflammatory effect and prevent the release of cytokines. Due to their side effect, prolonged use is not advised. They have been used pre-operatively to reduce the size of the polyps and post-operatively to prevent the recurrence. 2. Steroid nasal sprays. They decrease nasal polyp size and the edema of nasal mucosa. 3. Nasal irrigation. They are helpful in removing pathogens, allergens, load, and thick mucus. 4. Antibiotic. They can be used in case of acute exacerbation of chronic rhinosinusitis with Streptococcus pneumoniae, Haemophilus influenzae, and other bacteria. 5. Management of allergy in patients with history of known allergen. Immunotherapy may be prescribed. 6. Treatment of asthma. Asthma is a comorbid condition in case of chronic rhinosinusitis and should be treated with help from a respiratory physician. Surgical treatment. Phase functional endoscopic sinus surgery. If the medical management or treatment often fails in massive nasal polyposis and requires endoscopic surgery, all polyps are removed and drainage and ventilation provided in all involved sinuses. Many cases require revision surgery for recurrence of polypi. Cases of systemic fibrosis and ciliary dyskinesia require specific modification of endoscopic surgery to provide dependent drainage in maxillary and sphenoid sinus infection. Ciliary function is non-existent and the mucus is too thick to allow drainage. Thank you.